I'm Dr. Thompson Akwo Ntuba, the Chief Editor of Health and Development Magazine, and we are at the Convention Center, downtown New Orleans, this 5th of April 2019 as part of the American Association of Occupational Health Therapists 2019 Annual Conference. With me is
Jackie Condona.
Nice to meet you, Jackie. Why are you in this conference?
Oh, I attend annually to network and learn and also keep updated with what's going on within my profession.
Which sector of the profession do you work at? Government, non-profit, private, personal? Where do you fit in?
Well, I work with the elderly, so I work in York, Pennsylvania at Encompass Rehab Hospital. It's an inpatient acute rehab hospital.
Inpatient acute rehab hospital. What about occupational health that will present as an acute case to you?
So my most recent I can think of is we get anywhere from young strokes to the geriatric population, people who come in, and usually it's a short stay with us in the hospital. So they come in right out of the acute care trauma hospital, local hospital, into our inpatient hospital, and the goal is for them to go home and transition back into the community. So we get them for about 2 weeks, and it's really focusing on their goals, what is important to them. For some people, it's just being able to dress. For others, it's getting stronger so they can go back home and take care of their families or take care of themselves. Older spouses taking care of older spouses. So it's all those everyday mundane activities that we do for ourselves, and then something happens, a person gets ill. For example, you get the influenza that turns into pneumonia and the person becomes septic all of a sudden. So how do we get them back to what they were able to do before, such as taking care of a child, taking care of a parent, or taking care of a spouse, and then transitioning them into their home and eventually back into the community where they belong, which is really our goal for every patient, that they're able to go back to those everyday activities of daily living that are important to them and to their families.
There are some people who think that those who are involved in home-based care with certain disabled people, especially those whose disability is related to their occupation, be they VA, military people who sustain injuries, while at work, or at occupation and related issues, fall under occupational care or therapy. What are your impressions or comments on that?
I think occupational therapy really is the one profession within the medical field that addresses a person holistically. So if the person is in the community, how are they doing at home? Because everybody lives in their home. How are they doing at home? Taking care of themselves, taking care of their everyday activities, and then transitioning into the community. How are they interacting with the different places they have to go to? A person who wants to go to church, how are they able to access that? A person who wants to go grocery shopping, how are they able to access that? That is where we come in, because we look at what's important to them, what's meaningful to the person. Because if it's not meaningful to the person for them to thrive in their everyday living, then that's not something we address. But if it's something that's important to them, some people just want to stay home. That's okay. So we help them be independent and thrive in their homes. Those who want to go into the community, we help them transition into the community. Sometimes it's helping someone get access to the community. How do they get into their car? Do they need public transportation? We collaborate. It's not just us as occupational therapists. We pull in other resources to help the person thrive with whatever they want to do, whatever is important and meaningful to them.
Lovely. If you attended the meeting last year, you may have noticed new things. And what is new in occupational therapy?
What is new in occupational therapy at this point is really using a lot of evidence to support what we are doing. It's not new, but we're strengthening, really putting out evidence to support and show that there is evidence to support what we're doing. We're not just doing mundane, repetitive activities, but physiologically and with a person's mind and their spirit, we're able to change that. So it is really pulling in a lot of evidence, not just within our profession, but also collaborating with other professionals as well. So really, the focus on evidence, we're pushing for that.
How does those who become occupational therapists get trained and certified?
Well, we have two. We have the occupational therapist, which is right now is a master's and an entry-level master's and doctorate. Different schools have different paths. And then we have the occupational therapy assistants who help with the interventions. So the occupational therapists practicing at the highest level, the top of their license, are doing that comprehensive evaluation and assessment of those occupations, so those everyday activities that people are struggling with. What are you struggling with? Is it bathing? Is it dressing? Is it feeding yourself? Is it going to work? Then we try to find out what problems what's contributing to that deficit, and then really addressing those deficits. So for the occupational therapist, who really is the lead on our team, creates the plan of care, and then the assistants help us in implementing that plan of care. And at this point, the assistant program is a 2-year associate degree in different schools throughout the country. And for the entry level, which is for the lead, we have the master's and the doctorate. And different schools have different requirements for that.
Finally, there are more women in these meetings than men.
Yeah.
How do we improve on diversity and inclusion vis-a-vis gender and also minority, like more Latinos, African Americans, Asian Americans, Indians, and comment?
So it is true that this is a predominantly female profession, but as I joined the profession, I'm seeing a lot of male. Like I have male colleagues. I had male classmates. We are reaching out. I know my son, who's about to go into college, really looked at occupational therapy, and that is one of the professions he's looking at to ultimately do when it's time to do his master's program. So it is open out for men and people. I'm a person of color and I love this profession. It's just awareness, bringing awareness to the fact that this is a great profession. I can't imagine myself doing anything else, So really it is bringing the awareness that this is a very fulfilling profession, and we're not all working in hospitals. We're not all working with children. We have occupational therapists that are working in industry with designing workspaces, with designing programs. So there is a lot out there. Wherever you can find a person, an occupational therapist can be of help. And the possibilities are endless. So really, to my fellow people, minorities, come on, join the profession. It's open, it's welcoming, it's a great place to learn and grow. I always say this is like, for me, a retreat. I come to conference, I get empowered, I renew my energy, my commitment to the profession, and I go out there and I have a blast. I love what I do. I can't imagine I get paid to do what I do, so that tells you a lot.
And for an assistant, how much would they make in a year?
It depends on the state, and it depends on the area that you're working. So there are resources online that you can Google. Right off my head, top of my head, I don't remember. That would give you by state what you can expect, the median income for therapists. But then if you work in a hospital, which has more benefits, which covers a lot more of your costs, you might not make a lot. Or if you're working with a nonprofit that's really not a for-profit organization, you might not make a lot. But this profession, we all have bills to pay, but this profession, the rewards you get is way more than the money you're going to make.
Thank you very much.